Hello, my name is Ho Jun Yoon. I'm a second-year medical student from Wayne State University School of Medicine. I'm working with Han-Gi Lee, a third-year medical student, as well as Dr. Yu-Chen Ding, who is our research mentor. And the title of our abstract is Central Core Syndrome: Where It Went Wrong, When to Decide Treatment Options. So central core syndrome is an incomplete spinal cord injury typically caused by acute hyperextension injury with disc herniations or spinal injuries without any apparent radiographic abnormalities. Once in a while, it is caused by non-traumatic causes such as epidural abscess, which has been reported. It is typically presented with weakness, paresthesia. However, other various signs and symptoms may show. Because of this, central core syndrome is typically diagnosed clinically. Treatment options are largely divided into two groups: surgical versus medical. First, external cervical orthosis, or commonly known as neck brace. And this is just there to stabilize your cervical alignment, to minimize any further movement, which exacerbate further surgical injury. We can also tightly manage blood pressure in order to provide adequate blood perfusions to the injured site. Steroid has been used to alleviate post-injury inflammation. And GM1 ganglioside is not a well-established treatment option. However, it is believed to prevent apoptosis and promote neuritic sprouting with the effect of nerve growth factor and anti-excitotic activity. And lastly, surgical decompression. Unfortunately, this has been historically associated poor outcomes, and this has been well studied by Dr. Schneider. However, the current guideline established by AANS and CNS explains that an early surgical reductions of fracture dislocated injuries is recommended, and also surgical decompressions of compressed spinal cord, particularly if the compression is focal and anterior, is recommended. And these opposing views are largely due to the fact that the surgical skills used in 1950s for patients with central core syndrome were quite invasive compared to the ones that we do in these days. Also, there weren't many advanced imaging studies available at the time to correctly diagnose central core syndrome. Nevertheless, the guidelines are still limited in addressing treatment options for those without significant traumatic injuries such as fractures, dislocations, or cervical malalignment. Plus, we don't know how early we should surgically decompress these patients with central core syndrome. Since the publications of the guideline, Yoshihara and Yonioka collected data from 2000-2009 and published their result in 2013, which showed that the prevalence of surgical treatment for central core syndrome almost doubled from 2000 to 2009, and almost half of this group had surgical procedures between day 0 and day 2. Wagner et al. Later published their article supporting surgical interventions which provided improvement in neurological functions in patients who had central core syndrome. Interestingly, Arabi et al. Had 42 patients with central core syndrome and divided these people into early versus middle versus late, which is within 24 hours versus 24 to 48 hours, and a late group was more than 48 hours who had a surgical decompression. And they found there was no strong correlations between the timing of the surgery and the outcome. Park et al. Also had a similar finding that there was no strong correlations between timing of the surgery versus surgical outcome. And Anderson et al. Reviewed 9 studies and nicely summarized that surgery within 24 hours of injury appeared to be safe and effective for the patients with central core syndrome. So in summary, from this project, we found that poor outcomes associated with surgical decompressions were largely associated with invasive surgical technique that were utilized in 1950s. And the prevalence of surgical decompression has been increasing, largely due to advanced surgical techniques and imaging studies available. And because of these advanced skills and technology, we are now able to identify various underlying pathology. So perhaps all these conflicting data that we have been seeing may be due to the fact that we have been ignoring various underlying pathologies causing central core syndrome. Because it has been considered a clinical diagnosis, we weren't able to group people with different underlying pathology causing central core syndrome. Future studies may categorize patients with central core syndrome based on their underlying pathologies and find out which treatment modality provides optimal outcomes. Thank you for listening to our presentation.